This is americasdemocrats.org, the weekly netcast for stand-up Democrats. I'm your host, Jim Cuddy. The Paul Ryan budget, the one that believes black men don't have the culture to work, comes under attack from Democratic strategist Ed Kilgore. With Obamacare once again under fire at the Supreme Court and another sign-up deadline passing, healthcare analyst Phillip Longman talks about the policy challenges facing the Affordable Care Act. And law professor Stephen Griffin asks and answers how Congress can take a bigger role in decisions to go to war. Are you tired of Tea Party Republicans and Rush Limbaugh dominating the airwaves? Do you want the facts you won't get on Fox or even on CNN? Then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight, and follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. While Paul Ryan rants about lazy black men, Democratic analyst Ed Kilgore says the congressman's budget is a no-compromise holding pattern meant to kill, not just slow down, social programs. And we welcome Ed Kilgore to the program. Ed is managing editor of the Democratic Strategist, has an extensive background in political analysis and communications and public policy at the federal and state levels and in the Washington think tank world. He's also formerly vice president for policy at the Democratic Leadership Council. And if that's not enough for you, he is the principal blogger at the Washington Monthly's Political Animal blog and was co-moderator of a forum with American Prospect's Kit Rackless. Ed Kilgore, you got a lot of hats, and we welcome you to the program here on americasdemocrats.org.
Thanks. Glad to be here.
The recent publication of the forum on issues facing progressives and the social safety net seems to suggest that the word entitlement is political dynamite. Do you agree with that? And if so, what word should replace it?
Well, it probably is, particularly the way it's been utilized by Republicans in recent years. It used to connote security. Now it more connotes undeserved or unearned benefits. So I would simply say safety net programs, or in the case of Medicare and Social Security, just retirement programs, is a more neutral descriptor.
Mm-hmm. Progressives, of course, are constantly fighting to save Social Security, Medicare, Medicaid, and food stamps. But is there a discussion to be had about restructuring or maybe even cutting some of those benefits?
Well, I think those who read the forum will see that, regardless of how our contributors feel about the bottom line, they're all interested in restructuring the programs to make them more progressive, more relevant to the actual needs of beneficiaries. So there's a discussion to be had about restructuring. When you talk about cutting, there really is a divide between those who feel that the overall level of benefits for Social Security need to be curbed, however moderately, and those that don't. But even there's a separate argument to be had as to whether, in order to make the benefits more progressive, we might need to means test the programs a little more than they are. It's sometimes not completely understood that actually Social Security and Medicare are, in important respects, already means tested.
Mm-hmm. So
any restructuring of the program certainly could reduce benefits for high-income people without really violating the basic structure of the program.
And it would, obviously, to me anyway, it would be wise to just, a little bit at a time. Let's kind of test the waters on things, right? And yet you constantly hear from the right something a little bit different, like cut, without even thought.
Well, the whole reason we had this forum is to sort of separate from that whole fight with conservatives who, in many many of whom are not really interested in preserving these programs in any form.
Right.
And have a separate intra-progressive discussion about, how to improve the programs, how to make sure they're still around, and also to separate substantive from political arguments, which we tried to do.
Mm-hmm. We're speaking with Ed Kilgore, managing editor of the Democratic Strategist. Neither President Obama's budget nor Paul Ryan's budget is going anywhere, but they both make statements. How do you interpret the statements? And Is there any possibility at all for compromise, especially in an election year?
The short answer to that last question is no.
As I anticipated.
There's a possibility for a discussion in some limited areas. There's been a lot of buzz about both the president's budget and perhaps the Ryan budget, expanding EITC benefits for poor working people who don't have kids. But we'll have to see if Ryan's really serious about doing that without cutting the overall EITC benefit. As far as statements, President Obama's budget basically says here's the kind of budget we could have if Republicans weren't obstructing my every move. I think the Ryan budget this year is more of a holding pattern. I don't expect him to try anything that terribly bold. But again, the math of Republican budgeting always requires significant non-defense discretionary cuts, and because they've been shying away from retirement program cuts lately, that usually means handling low-income programs. That's not really the statement Paul Ryan wants to make, though.
Right. Now, doesn't the decline in the federal deficit actually mean that more resources should be directed to safety net programs?
Well, certainly it means that continuous efforts to reduce them don't make a whole lot of economic or political or substantive sense anymore. And yes, there are some people who would argue that to the extent that we probably need some fiscal stimulus to keep the economy going, that some of those resources could be added to safety net programs. I would say the center of the world now is that non-defense discretionary programs, investments, education, infrastructure, environmental protection, scientific research, or the part of the budget that's being starved. Most of the debate over retirement programs is around heading off reductions rather than calling for increases. So there is some renewed interest among progressives in expanding Social Security because our whole private retirement savings system is in shambles.
Yeah, absolutely. How successful do you think Defense Secretary Hagel will be with his request to cut and modernize the U.S. military? I mean, as you mentioned, that you haven't been able to touch that in the past. Could there be another peace dividend that can go to domestic priorities?
Yeah, though I think some limited reductions in defense spending are already kind of baked into the cake and are already assumed by, in current long-range budget estimates, much as they were at the end of the Cold War. I think Hagel will probably be successful, in part because there's a bit of a split developing in the Republican Party over defense spending, a lot more support for limiting overseas commitments than there used to be. So I'd say the politics of this probably cut in the administration's favor at the moment.
Mm-hmm. Again, we're speaking with Ed Kilgore, managing editor of The Democratic Strategist. Before we let you go, Ed, how will Medicare and Medicaid be affected by Obamacare? Is the jury going to be out on that for quite a while to come?
Certainly, it will be for very different reasons. In the case of Medicare, aside from the Affordable Care Act's reduction in subsidies for what's called Medicare Advantage, which is sort of a conservative pet rock introduced in the Bush administration, subsidizing private insurance under Medicare, that is already being implemented. There are also some assumptions of Medicare savings based on the idea that Obamacare will generally reduce, as it seems to have done already, healthcare inflation. That will reduce spending on Medicare without necessarily reducing benefits. There's some long-term implications of the Affordable Care Act in terms of, Medicare services, particularly provider payments, and how they're structured, that could significantly change not so much benefits, but how Medicare is financed in the future, which could have a big impact on both healthcare spending and Medicare. In the case of Medicaid, of course, the big imponderable is what's going to happen in I think it's now 25 states that have not yet taken advantage of the ACC's Medicaid expansion. Some people are optimistic that the states that have not participated in this will go along. I'm not quite so optimistic, but in any event, we now have pretty much a two-track Medicaid system affecting with each part reflecting roughly half the country. And Republicans in the long run would like to see Medicaid turned into a block grant, which would make it no longer an entitlement program in any sense.
Is that the reason? Because, I mean, Medicaid expansion in the states makes sense economically for each of those states. So is that why you refuse it? I mean, because you want to actually change what Medicaid is?
Yes. An awful lot of first of all, a lot of the Republican governors and legislators who are opposing the expansion, they may cite fiscal arguments that frankly aren't very strong, but part of it is a refusal to be complicit in anything associated with the Affordable Care Act, and part of it is frankly, these folks don't much care for Medicaid anyway, would like to see it block granted, reduced, and in some cases even abolished, so they certainly don't want to expand it, even if it makes fiscal sense for the states.
The wealthiest nation in the world turning away the poor. That does not make sense. Ed Kilgore, managing editor of the Democratic Strategist, formerly vice president for policy at the Democratic Leadership Council, also principal blogger at the Washington Monthly's Political Animal blog. Ed, thank you so much for your time with us today on americasdemocrats.org. We look forward to having you back again soon.
Anytime.
Thank you. And this is americasdemocrats.org, the weekly netcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to Democrats for America's Future and help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page. This is americasdemocrats.org, the weekly netcast for stand-up Democrats. With another sign-up deadline passing, health analyst Phillip Longman explains that Obamacare is really only about financing, not about a broken delivery system. And we'll talk to him about that in just a moment. Right now, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
Progress. In the 2012 elections, Republicans cast themselves as budget balancers by promising to whack welfare programs for the poor, snarling that such people are takers and moochers. Such vindictive sourness didn't play too well with voters, and Republicans now seem to have learned their lesson. Oh, they're still going after food stamps, school lunches, etc., with a vengeance, but this time with a gentle, even loving tone. The GOP's official message massagers now have their members saying that they want to, quote, help the poor by eliminating those programs, referring to them as soulless giveaways that sap their initiative and tether them to the cold, uncaring hand of government. The message is, we're doing this for the poor people's own good. Their chief budgeteer, Representative Paul Ryan, trotted out this theme at a recent right-wing rally, condemning school lunches as unloving Obamacare, plopped on plates by unsmiling cafeteria personnel. What they're offering people is a full stomach and an empty soul, he oozed. If that doesn't make you gag, try another subsidized lunch program that tender-hearted GOP budget whackers never mention, much less demand that it be eliminated. It's the tax subsidy for corporate meals, drinks, and entertainment. Multimillionaire CEOs can go whining and dining on your and my dime, writing off their high-dollar lunches, cocktails, dinners, and club hopping as a business expense. And expensive it is for us taxpayers. This subsidy adds up to more than $12 billion a year. And that doesn't count the human cost of executive initiative that is sapped by this giveaway, and the lack of love a CEO feels from being dependent on unsmiling taxpayers. This is Jim Hightower saying we ought to be subsidizing healthy meals for poor people, especially school kids, but not a dime for fat cat CEOs dining out at Chez Gourmand.
Need an antidote to the progressive blues? Want some good news about how grassroots folks are rebelling against the corporate powers and winning? Well, here's an easy-to-swallow pill for you, the Hightower Lowdown. Hightower's monthly newsletter will give you the lowdown, even as it lifts you up. It's 4 pages a month, jam-packed with facts you can use, actions you can take, and Jim's own Texas humor, all for only $15 a year. To become a lowdowner, go to hightowerlowdown.org.
This is americasdemocrats.org, the weekly netcast for stand-up Democrats. Phillip Longman has studied the U.S. healthcare system and recommends it be treated as a common carrier, like a utility, in which prices are openly set for specific procedures. And joining us now on americasdemocrats.org, the weekly netcast for stand-up Democrats. Phillip Longman is senior editor of Washington Monthly, senior research fellow at the New America Foundation, and teaches healthcare policy at Johns Hopkins University. Phil Longman, thanks very much for joining us today on americasdemocrats.org.
Thanks for having me.
Now, you've written extensively about healthcare quality and healthcare costs. By this time next year, what will Obamacare look like?
Well, I imagine that we'll have the website working better.
I hope that's not too much of a stretch.
Yeah. So that's all good.
Sure.
Yeah, and many people's lives will be improved by the fact that they're no longer discriminated against on the basis of pre-existing conditions and such. But we will face many new challenges a year from now. Many of these are challenges that pre-existed in the healthcare system before Obamacare, and some that are in different ways actually made worse by Obamacare. So we need to face up to that and move on to the next stage.
But when we're talking about things like that, and in very general terms, of course, there are things that can be massaged or fixed or amended in some way, shape, or form to kind of get us back on track, correct?
Well, sure. I mean, we've got a good vehicle, a good start here. But Obamacare is mostly about the financing of healthcare. Who pays for what in healthcare, and how do they pay? It is not directly or very much about the actual delivery system of healthcare. And our delivery system is quite broken in many ways. It's not just that the system is very expensive and prices a lot of people out of access to it. It's actually, in many ways, dangerous. A lot of people don't realize that contact with the U.S. healthcare system is literally the third leading cause of death in the United States after all cancer and all heart disease. Because when you add up the number of people who are injured by medical errors, contradicted drugs, and unnecessary surgeries and such like that, it's well over 250,000 people a year, and that makes it the third leading cause of death in the United States. So we got a lot to work on in just making healthcare better.
One of the dilemmas you point out is that a healthcare system gets bigger and bigger. There are more efficiencies in both cost and care, but as private systems get bigger, they tend to engage in monopoly pricing. Is a single-payer system the only solution?
Well, to be clear about what different terms mean, right? What single-payer means is that there's some single payer of healthcare, not some single provider of healthcare. Mm-hmm. Right. So Medicare is an example of a single payer system. The government pays the bills, but all kinds of private sector actors actually perform the work. Right.
Right.
So a single payer system can be something that looks like an HMO, or looks like the Veterans Administration, or looks like our current system, except that the government pays for it every single bill. Right. So the Canadians, for example, have a system that's basically Medicare for everybody, but they don't have government-run hospitals. So single payer isn't really the point of distinction. The point of distinction is how is the actual care delivered and organized? Is it delivered efficiently? Is it delivered safely? Is it delivered at a reasonable price? And right now, our healthcare system, such as it is failing on all those points. And Obamacare by itself doesn't really do much to fix that. And as I said before, in some ways, can make some of these problems worse unless we make corrections.
Now, you make the case that in every community, doctors, hospitals, and health systems keep raising prices. But if consumers can force down prices for, say, cell phones and big screen TVs, why can't they make rational decisions on health care costs? I mean, is it ignorance? Is it fear of being sick?
Well, the healthcare market really doesn't exist. Most of us have no way of knowing even what our healthcare costs, right? The prices that hospitals charge different patients are not published by and large. We have no way of knowing what they are. Hospitals engage in rampant price discrimination, so the same person in the same hospital room with you getting the same procedure can be paying a wildly different price than what you are paying or what your insurance company is paying. So we have a situation in the United States today where markets can't really work because A, nobody knows what the price of anything is. B, nobody really knows how to value the quality of the services they're getting. And three, increasingly, which is what I've been writing about most recently, is that more and more of the provision of healthcare is now monopolized locally. So that basically in most communities in the United States, there is no competition among healthcare providers, certainly hospitals, because the hospitals have all merged with each other to the point where there's effectively only one system.
We're speaking with Phillip Longman, senior editor of Washington Monthly, senior research fellow at the New America Foundation, and teaches healthcare policy at Johns Hopkins University. What role does health insurance play in the stagnation of wages?
It's enormous. Well, I should say, what role does the price of healthcare pay, right? In 2002, right, the average family in America was paying about 18% of their income in healthcare costs. Right? Today, already, it's 35% that they're paying.
Wow.
Right? So that's, in effect, if you think about it, that's as if the George Bush administration had enacted a 17% payroll tax on every family in America. And then what do you suppose would have happened if they had done something like that? Well, I think a lot of people would have found it very difficult to pay their bills. They might have had to go deeper in debt. Many of them might have fallen out of the middle class, might even have had a great recession if something like that happened, except that something like that, in effect, did happen. That's what happened to the American family since 2002, is we've had that kind of effective payroll tax imposed on them. And so it's no wonder, right, that we have a shrinking middle class. That's not to say that healthcare is the only reason for the shrinking middle class, but it is in itself enough to explain pretty much all of the lack of wage increase since 2002. I mean, the average American worker is enormously more productive, has greater efficiency than he or she did in 2002, and yet that hasn't translated into wages. Instead, where that money has gone to is in healthcare, particularly employer-provided healthcare premiums. And it would be one thing if for all this extra money we're spending on healthcare, that if we were living longer, if we were living better, if more of us had access to healthcare, but none of those things are true. So that's why we need to now really focus on the provision of healthcare, the actual hands-on delivery of healthcare, as opposed to how we finance it.
Well, you know, and that's a good point you make, because conservative critics of government health care say that it will ruin the best system in the world. But as you point out, we don't necessarily have the best outcomes in the world. And if I'm not mistaken, our costs are much higher than most industrial countries, correct?
They are. And the reason is not because we're a bunch of hypochondriacs. It's not because we get all kinds of tests and treatments and scans that other people in developed countries get or don't get. It's that we pay more for the same stuff, right? So Germans get just as many MRI scans as we do. They just don't. They pay just a fraction of what we do for them, right? So a typical specialist in the United States makes $800,000 a year. His counterpart in Germany makes half that. That's the difference, and that's the true measure of healthcare inflation, right? Is paying more for the same stuff. I don't think anybody begrudges a healthcare system that costs more because it's making people healthier and live longer. But that's not why the healthcare system is, or mostly that's not why the price of healthcare is going up. It's not that we're getting more medicine; we're just paying more for the medicine we get.
Mm. Well, and you often hear about people that go to Canada to get their drugs or elsewhere to get their drugs because they can't afford what they need here.
Right.
Yeah.
And by the way, on those comparisons too, many of us are waiting in lines to see doctors. I mean, just as long as we might wait in Canada. Certainly throughout most of rural America, there's long queues to see lines. We have a tremendous shortage of primary care doctors in the United States. I live here in the white nation's capital. I can't find a primary care doctor to save my life, right?
Yeah.
So we're rationing by queue, too, as well as paying all this extra money.
Now, you suggest that healthcare services be considered as common carriers, such as utilities or airlines. Explain the concept for those of us not well-versed in regulatory law.
Well, there's many ways in which healthcare wants to be a monopoly, wants to be big, right? It's like in making steel, having a hospital that has an integrated system, that has economies of scale, that can be a good thing, right? In other realms of life where we find things like that are, say, electrical generation. It doesn't make sense for a city to have 8 different power companies running 8 different systems of power lines in everybody's house, or 8 different water systems, right? Things that are natural monopolies. And the way we deal with natural monopolies is, when we do, right, is to have a political process for setting their prices. And in this article I've written for Washington Monthly, that's what I'm proposing, along with my co-author Paul Hewitt, is that we look at a public utility type model for pricing healthcare, pricing the cost of specific procedures in hospitals, making those prices completely transparent. Because unfortunately what we have today is too much of what goes on in the so-called market for healthcare is people trying to push costs on to other people. So the people who pay the highest prices in hospitals are the people that have the least power. And we want to change that. And we think the system can be much more efficient and equitable if we have a transparent system where we set prices administratively.
Okay. Phillip Longman, senior editor of Washington Monthly, senior research fellow at the New America Foundation, and teacher of healthcare policy at Johns Hopkins University. Phil, thank you so much for joining us, as always, on americasdemocrats.org. Look forward to doing it again soon.
Thank you.
All right.
Take care.
You too. And this is americasdemocrats.org, the weekly netcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to Democrats for America's Future to keep this show on the air and help elect stand-up Democrats. Go to americasdemocrats.org and click on Donate at the top of the page. This is americasdemocrats.org, the weekly netcast for stand-up Democrats. When Russia annexed Crimea, it once again raised questions about the role of Congress and the White House in establishing foreign and national defense policy. Law professor Stephen Griffin says Congress should centralize its own decision-making. And we welcome Tulane University law professor Stephen Griffin, who specializes in constitutional theory and history at Tulane Law School. He's also the author of a new book called Long Wars and the Constitution. It's about the roles of Congress and the presidency in conducting warfare. Professor Stephen Griffin, thanks so much for joining us today on americasdemocrats.org.
It's my pleasure to be here with you. Thanks very much.
Now, you write in detail about the constitutional balance or imbalance among the branches of government when it comes to war. Don't we also have a constitutional conflict over balancing national security interests with democratic values, like privacy?
There's no question about it. I mean, over the last year, this has been the issue everyone's been focusing on, at least in terms of the revelations about national security agencies' surveillance and how the government seems to be sweeping up all of our data and storing it in computers. Now, I have to say, I don't want to put anyone off. I'm not buying the book, but I have to say that these kind of security or civil liberties issues are not the main issues I focus on in the book. But let me explain why. I think the damage done to our country, and particularly members of its armed forces, is far greater when we have a war that arguably wasn't justified, like the Iraq War. And the impact certainly to our nation, on our nation's budget, of hundreds of billions of dollars, if not $1 trillion spent on the Iraq War alone, and the damage done to our armed forces and the people we've asked to lay down their lives for their country, I think that actually puts in the shade civil liberties concerns. And that's why I didn't talk much about civil liberties in the book. I know some people are going to disagree with me on that and think that the civil liberties concerns should be at the forefront. But what I think should be at the forefront is concentrating on these key decisions for major wars. And so in the book, I focus especially on Korea, Vietnam, the Persian Gulf War of 1990 or 1991, sometimes called the Gulf War, and Iraq and Afghanistan. I'll talk about a lot of other things too, because I want to set all of these wars in context. But I think that is the most important issue, the decision to go to war.
And you argue in your book that apart from the legal or political standpoint, it's bad policy for a president to ignore Congress in executing military actions. But how can Congress possibly act rationally in this day and age, or the way it's going lately, forever, or ever that matter?
Right. Congress doesn't exactly enjoy the healthy confidence of the American people right now, and arguably that's been true for a long time. But let me separate those. One of the main argument for the book is indeed that presidents, it's not just unconstitutional or wrong constitutionally for the president not to consult Congress or otherwise involve Congress. I argue that it directly causes the formation of bad policy in the executive branch, when the executive branch doesn't have to think in a concrete way about consulting Congress and justifying its foreign policy to Congress. But it's also true, it's absolutely true, Congress has to be organized, in effect, to receive the presidential request for consultation. And that hasn't been true for a long time. In the intelligence area, over a period of years, Congress evolved a structure which seems to work. It's not flawless, but nobody argues, for example, that we should go back to the situation we had before Congress came up with the intelligence committees and that sort of structure, and the structure of really no consultation in the 1950s and 60s, where members of Congress literally said to the president sometimes, "We don't want to know what you're doing." Well, I'm afraid they can't avoid knowing, and we've evolved a structure on the intelligence side which at least works better than the past. Well, that's what we need to do for national security and foreign policy generally, and with respect to, and that's the only thing that can put us in a better position to make better choices when we have to make decisions for war, or at least that's what I argue in the book.
And you emphasize the need for a president to be accountable for the making of military policy, but isn't that what elections and the impeachment power are for?
I think there's no question that the presidents see themselves as accountable. We actually have to be, if we're looking over a long period, like I do, since 1945, we actually have to be somewhat careful about saying that presidents are accountable through elections, because after the 22nd Amendment, presidents know sometimes in their second term they know or can take actions that they don't have to worry about another election. I actually think you could argue this made a difference to some of George W. Bush's decisions in his second term, when he sort of ran the Iraq War into the ground. He lost control of Congress, but he didn't fundamentally want to change his policy. And so it's actually not true that we always have the electoral check, at least after the 22nd Amendment. But the real issue is what's going to be the accountable process when decisions for war have to be made. We don't have a parliamentary system. We don't call elections to decide policy issues. That means the crucial negotiations or deliberations have to go on between the president and Congress. So I don't see elections and impeachment as even especially relevant, since we don't organize those constitutional tools around the dates of specific policy decisions. So what really needs to go on is a deliberative process, an interbranch process between the president and Congress.
We're speaking with Tulane University law professor Stephen Griffin, author of the new book Long Wars and the Constitution. So if you would, can you lay out how a Congress could work with the president to jointly determine a timely military action?
Well, you're sort of asking the question that the authors of the War Powers Resolution were asking themselves. Maybe they didn't come up with the best solution, but that's the right question. Their basic idea was there has to be consultation from an early period. The insight a lot of scholars have had, not just me, is that if the consultation is to work effectively, you have to centralize decision-making power in Congress, in both houses, in a committee, or in a committee and plus the leadership that has sole control over national security and foreign policy matters. And if that sounds a little frightening, well, that's what's required for Congress, in effect, to keep up with what the president is doing. And if we value congressional input, and I spend the whole book arguing we should value congressional input because it makes a difference to how the executive branch makes policy, then something like that is required. So Congress has to reform, in other words, its internal structure. Luckily, we can do that without a constitutional amendment, so that's not what we're talking about. But Congress, in other words, has to get its act together with respect to foreign affairs and national security generally, in the same way that they have roughly gotten their act together with respect to intelligence policy.
So there has to be a will to take this on.
Yeah, well, that is where a lot of scholars have ended their inquiry, because it's hard to see how does Congress get interested unless the voters are interested. But I think since we did it on intelligence policy, which arguably not a lot of voters are interested in, I think we could probably do it on national security and decisions for war. What matters is getting members of Congress together for these committees that are interested in these decisions. Then you've got the critical check that the Constitution has in mind.
Mm-hmm. Now, since the end of the Cold War, the United States has reacted with military force dozens of times on large scales and small scales. Which interventions do you think were carried out well?
Well, see, I make the case that presidential decision-making, the process of making decisions about what the war is all about, especially with respect to things like war aims, wasn't carried out especially well for any of the major wars I talk about. Now, I do think that on balance, Truman made the right decision on a policy grounds. If we had to rerun history, as it were, I think we could. I think the Korean War can be justified on policy grounds. But that doesn't mean that Truman did a good job anticipating all the dangers, and doesn't mean Congress did an especially good job anywhere. Everyone thought it was a great idea to go north of I believe, the 38th parallel. No one really foresaw the intervention by China in the winter of 1950 that transformed the war and really made an enormous difference to what kind of a war it was. But Congress could have been more on board for that, since they weren't on board, because Truman never asked Congress for a declaration or an authorization. That meant Congress could just cut itself free and regard the war as Truman's war. Well, that's not good for policymaking. So we've had successful humanitarian interventions here and there. I certainly supported President Clinton's Kosovo intervention, and you can argue that the initial stages, certainly, of the war in Afghanistan went very well. But on balance, in terms of the decision-making process presidents have engaged in, what they have foreseen, what the options they've had laid out in front of them, most of those processes have been very inadequate. And I think that goes back to the fact that we've departed from the original constitutional arrangements.
Mm-hmm. What is Go ahead.
The original constitutional plan is what I call it.
Mm-hmm. Now, what is the appropriate response to non-state aggression?
Well, that's a really general question. I agree that a war was called for after 9/11. I know many people disagree with that. I've had conversations with people who think that it should have been treated solely as a crime. But the fact that Al-Qaeda was this, call it what you will, a paramilitary organization using arguably weapons of mass destruction, they had capabilities far exceeding any normal criminal organization, and they couldn't be taken on except through military means. So I would agree with the general policy of the government. It's really been a policy that's actually been approved by the American people in a number of elections. If the American people were in disagreement, with treating the conflict with Al-Qaeda as a war, they had several chances to indicate that disagreement, but they did not. And none of the losing presidential contenders ever since the 9/11 attacks made the case that it should have been treated as a crime. So I really think that's a minority perspective. So when you have a non-state actor like Al-Qaeda that has their capabilities, I think you have to go after them, and you have to go after them. I think you have to treat it as a war. Now, could other non-state actors call for different tactics, even ordinary police or criminal law? Sure. It just depends on the circumstances. But with respect to the conflict in front of us, I think it was legitimate for both Congress and the president to regard the situation after 9/11 as a war.
Okay. And before we let you go, is the War Powers Resolution a dead letter?
Well, this is one of the deepest misconceptions out there. I could go on. I'm afraid I could go on for days because it's the misconceptions run so deep among journalists and members of the public, I'm afraid. So, number one, it's not true that all presidents have constitutionally objected to the War Powers Resolution. The Carter administration, the Clinton administration, the Obama administration made no constitutional objection to the War Powers Resolution. So it's still very much on the books. And furthermore, we just had a very clear lesson that it's on the books in terms of something that can be used as a weapon of criticism against the administration by even the Republicans, because we went through all that over Obama's intervention in Libya, which was controversial on various grounds. But one thing that showed very clearly is that the War Powers Resolution is alive and well in Congress, at least as a method of criticism and raising questions after the 60-day limit is applied. People are frustrated that presidents don't automatically obey what's called the 60-day clock in the resolution. But the fact that presidents still have to reckon with the resolution, the fact that it is deliberately cited in Congress and regarded as a point of a criticism if the president is seen to violate it, I'm afraid shows that it's alive and well, and rumors of its death have been massively exaggerated.
All right.
So it's still around. It's still with us. It may be in need of repair, but it's still with us.
There are a lot of things that are in need of repair right now, I would say, right?
That's right. Congress, if we're talking about dysfunction generally, Congress, in my view, I'm sure in the view of many people, needs quite a massive overhaul. And I hope it gets one, and I don't think it will until presidential candidates start advocating that in elections. But I think the American people are on board with some congressional reform, and I hope that's coming in the future.
Okay. Tulane University law professor Stephen Griffin. He's the author of the new book, Long Wars and the Constitution. It's about the roles of Congress and the presidency in conducting warfare. Professor, thank you so much for your time with us today on americasdemocrats.org. We look forward to speaking with you again soon.
It was great to be with you.
All right. And this is americasdemocrats.org, the weekly netcast for stand-up Democrats. That's all for americasdemocrats.org. Thank you to all who made today's show possible. Ed Kilgore, Phillip Longman, and Stephen Griffin. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook. For americasdemocrats.org, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us, support the show, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate.